Thierry. Welcome back to the Total Spine video series. We're going to touch on today is conditions that can affect the underlying cognitive function of the brain. We're talking about Alzheimer's, we're talking about dementia, Parkinson's disease, conditions that affect brain function, okay? And how chiropractic can be a great alternative treatment to these conditions, as well as provide some significant benefits for people who are not in these stages yet, all right? So let's go. We'll look at some physiological constants and really some common sense things. The brain needs stimulation from a lot of sources. It needs chemical stimulation through the foods that we eat, putting proper nutrients into the body. It needs emotional input through the conversations that we have with people, having fun, reading, all those types of things. And then there has to be a mechanical component to this as well, right? And when we talk about this, it's important to realize that if we have the brain up top, 90% of the nutrition and stimulation of the brain is caused by movement of the spine. It circulates fluid, provides nutrients, and it is vital for overall health of that nervous system, specifically the brain and the rest of the central nervous system. All right, so 90%. That's where chiropractic can play such a huge, huge role. Now, as chiropractors, we are assessing the spine for areas that have lost their ability, their range of motion. Those joints have become locked, all right? Which means that they're no longer moving properly, and they can no longer provide the proper stimulation to the brain, all right? So around each joint in the spine, there are mechanoreceptors, and when the joints are locked, those mechanoreceptors are no longer sending information. So through the chiropractic adjustment, we want to accomplish really three things. Number one is identifying those areas to increase range of motion. All right, restore range of motion. Two, we're putting an input into the soft tissue as well, so there is a muscle component. We're putting a stretch reflex into that muscle, which allows it to relax afterward, simultaneously helping increase range of motion. And three, now that receptor is activated and turned back on, it can send a barrage of information back up the spinal cord to the brain. Now, it's important to note, too, that the brain is always in a state of learning. It always wants more input. And the more input and work we can put into it, we will be rewarded with increased cognition and increased function. All right. So that is how chiropractic can really, really benefit people. And unfortunately, when we have a locked joint and we've lost range of motion, we can't always feel that. Most of the time, these joints, we can't perceive that pain, or we don't get a symptom from it for sometimes months or even years down the road. So that's why it's so important to have your spine checked at an early age and maintain it as consistently as possible. So, of course, if you or anyone you know is suffering from any of these named conditions that we talked about at the beginning, we are certainly here to answer any questions. We would love to have you in here. We'd love to help you be your best and take your health to the next level.